Good morning. Welcome to the latest episode of the House Democratic Caucus's Debrief. This is a program where we are getting in depth on some issues that we know people care about and are interested in hearing about today. We are thrilled to be joined today by a special guest, Dr. Ross Goldberg. Dr. Ross Goldberg is the president of the Arizona Medical Association. He's also a general surgeon. He is the vice chair of the Department of Surgery and Specialty Ambulatory Medical Director for Valleywise Health. He's also an associate professor of surgery at both Creighton University Medical School and the University of Arizona College of Medicine, Phoenix. So we are really thrilled to have Dr. Goldberg joining us today. I am Kelly Butler. I'm the ranking member on the House Health Committee, and the other members of the Health Committee that are able to join us this morning are going to introduce themselves. Let's start with Representative Alma Hernandez.
Hi, thank you. My name is Alma Hernandez, and I'm from Tucson, and I serve on the Health and Human Services Committee.
And good morning. I'm Randy Fries. I'm also from Tucson, Legislative District 9. I'm also a physician, and I serve on the House Committee as well. And that's my squeaky toy. It's under my foot and under my desk.
Thank you, Dr. Fries. Actually, I am babysitting a puppy today, and the puppy grabbed a squeaky toy, which is not helpful at all for a Zoom call. This is a really important episode of the debrief because we know people are concerned about getting their vaccinations for COVID-19. We have heard from all of our constituents frustration about being able to get the vaccine, frustration about signing up. We know that in Arizona today, only 1.5% of the population has received both doses of the vaccine. So it's a big concern. We know that it's a supply chain issue. We aren't getting enough doses in Arizona, but it's also issues with distribution. So I want to ask Dr. Goldberg right off the bat, what can we expect going forward? What can we tell our constituents and folks in Arizona about how they'll be able to sign up? And hopefully we're going to hear some good news.
Well, first, thanks for having me. It's a pleasure to be here, and hopefully I can alleviate some concerns because we're hearing a lot of good news, right? So the new presidential administration is really aggressively attacking vaccine distribution. In fact, I just recently heard they're now going to get vaccines directly into pharmacies. Now, Arizona is not the first round they're trying this on, but what that's going to mean is by putting vaccines directly into pharmacies and bypassing the state won't lose their amount. That number will go up actually, because what the states have been doing have been giving some to the pharmacies. They're not going to have to do that right now. So what's going on here in Arizona is that, yes, right now they're finding out every week how many vaccines are coming. We know that Pfizer and Moderna are ramping up the amount they're making. A couple 100 million more doses have been purchased by the federal government. We also have the Johnson & Johnson data that's coming out now. So we expect them to be applying for that emergency use authorization from the FDA within the next week or two. And if you remember what happened back in November, December, it was really a short time from going through the process of the FDA to getting the vaccines available. And you're talking about a one-shot, easily stored vaccine. So a third vaccine in the market. And we know AstraZeneca and the Novavax ones are not far behind. So yes, while it's frustrating right now, over the next month or so, you may see an explosion of vaccines, which is great. And that way we'll be able to get it to more people. I know and understand the logistics are frustrating. One thing they are doing here is they're trying to get it into those pharmacies we talked about, Fry's among others. They're trying to widely distribute it. I have been a big advocate and hoping that we can get into more offices and things like that. We are trying to loosen the spread or widen the spread, if you will, to get it into more arms, make it easily accessible. But the logistics are tough, especially with the Pfizer and Moderna because of how you need to store them. But as we get these other vaccinations, that should be easier, and you may see like kind of an exponential growth of vaccinations available.
Our next question is going to be from Dr. Randy Fries, who is a surgeon in Tucson, and I think he's ready to go.
Thanks, Dr. Goldberg. That's really important information. It makes sense, though, the logistics of moving the vaccine out initially, where you bring the people to the vaccine. And now as we get more and more of the population that needs to be vaccinated, we take the people and then we bring the people to the vaccine to the people by getting it to the pharmacists and the primary care providers and things. I wanted to ask, and I'm fascinated by this vaccine is different than most vaccines that we know. This vaccine is an mRNA vaccine. If you can help everybody understand how is that unique and different and what advantages does that bring?
Right. No, it's a great question. Look, up front, I'm a nerd, so I love this stuff. This stuff's really interesting to me. So basic understanding messenger RNA, the mRNA, what is that? So we have proteins throughout our body that do a variety of things. You have to make them. The mRNA is basically the blueprint to instruct your cell to make a protein. It comes from DNA. So DNA, one of the things DNA will create is this messenger RNA that's in your cells that your cell will use. We get really technical, using something called the ribosome within the cell to actually use a blueprint and make these proteins, build them out of amino acids. You may see off my shoulder here some Legos. So I think of it like Lego instructions, right? Messenger RNA is a Lego set of Lego instructions for a cell, and it builds a Lego set. What the cool thing is that this messenger RNA doesn't stick around after that. So it sends the message to the cell, tells it how to build the protein, then it goes away. This is a new way of providing information to the cell through a vaccine. We have not done this before. It doesn't mean we haven't been studying it. The technology itself is about 20 years old, plus or minus, but it's a matter of research and funding. That's why we haven't gotten to this point. Technology has evolved where we can now deliver the messenger RNA, create it ourselves, deliver it to the cell, and the cell produces the protein. In this case, for COVID, it's producing the spike protein of the coronavirus. So the coronavirus needs a way of getting into your cell because it's not going to just be let in. So it has these spikes on it that allow it to violate the cell and get in and replicate. So what they have done is taken part of that spike protein's mRNA, given it to our own cells in the vaccine, and then our cells start producing this foreign protein. You're not making virus. All you're making is part of that spike. Your body recognizes that as foreign material that shouldn't be there. So you create immune response. You build antibodies to those spike proteins so that if you're exposed to that protein again, you already have the antibodies in place to fight it off. It's a really cool way of doing it. And obviously you see with Pfizer and Moderna and their efficacy rates that it seems to be working quite well and protecting the person from the spike protein. So this is all really cool stuff. I anticipate in the future seeing more mRNA vaccines coming out for other diseases, because now that we have this technology available, it's going to be a kind of a new revolution, I think, in vaccines.
And next, we're going to hear from Representative Alma Hernandez.
Hi, Dr. Goldberg. Thank you for joining us. I wanted you to touch a little bit about the importance of not only getting your first vaccine, but also getting the second one. In my community, in the district I represent, there's a lot of hesitancy around getting the vaccine. People are getting a lot of misinformation from the media, from social media, from the radio, unfortunately. So I just want you to touch a little bit about that and speak on the safety of it, because I think it's important for people in our community to understand that it is indeed safe to be able to get this vaccine.
It's a great question. So for the Pfizer and Moderna vaccines, they are two-shot vaccines. Think of one as a primer and the second one like a booster, and you boost your immune system. They are important to get both of them because the studies have shown they work together. You hear the 95% effective rate, that's with both shots. So I've been asked this before, can I get one and be okay? So the problem is the way they did the study is, yes, they found there was some response when you got the first dose of the Pfizer vaccine. They saw like an 80%, 85% effective rate, but then everyone got the second shot at the 3-week mark. It's a 21-day delay. So you don't know if that actually lasts. So we have no idea if getting one shot is sufficient enough to keep you protected for long periods of time. The only data that we have is from the 2 shots. So we really are advocating for everyone to get both shots. It's really important. You want to have that booster set up because you want to make sure if you're going to go through this, that you have protection from the coronavirus. And obviously we are seeing 95% is a great protection rate for Moderna and Pfizer. And we really want to encourage that among people. So again, if it's a 2-shot vaccine you're getting, you need to get both shots for it to really work. Again, that's why I mentioned the Johnson & Johnson's a really interesting vaccine because it's coming out. It's going to be a 1-shot vaccine. They actually are studying it as a 2-shot vaccine as well, but they're seeing it being pretty effective with 1 shot, which could help, I think, get to a lot of more people. But for right now, Pfizer and Moderna are 2-shot vaccines, and everyone really should get both those shots if they want to get protection from COVID-19.
Thank you very much, Dr. Goldberg. We've been joined by Dr. Ramesh Shah, who's also a state representative, and we're fortunate on the House Health Committee that we have 2 physicians who are part of our committee. And Dr. Shah is actually an ER doctor, and so I'm sure he has a question for you right now.
Hi, Dr. Goldberg. Good to see you again. Thanks for being here with us. My question relates to something that's been on a lot of people's minds recently with regard to the vaccinations and the rollout. So we've been hearing that we've gotten X thousand doses, and we'll be rolling these things out over the next coming months or probably half a year. I think the question on a lot of people's minds is, how long until we get to the amount of doses that's needed in the population, until we see a real crash in this thing, and when we can start to get back to a normal life, get back to maybe getting rid of some of the restrictions and the special things that we've had to do to keep ourselves safe during the pandemic?
No, I think it's a really important question. So you've heard this term a lot, herd immunity. It's been thrown around a lot, but comes to the vaccine is what's the level in the, obviously the population where we're vaccinated to a level that we've really stopped the spread of the virus. And they're saying somewhere around 75% is the last numbers I'd heard when I see Dr. Fauci giving an interview. And, I usually trust Dr. Fauci when he talks about these things. And so where are we? You heard 1.4% of Arizona. They've given 32 million doses so far across the country. We have 300 million people plus in this country. So we have a ways to go. But again, you talk about the Johnson & Johnson, they're on their way. Novavax is in phase 3 trials. AstraZeneca is already released in the United Kingdom, is in a phase 3 trial here. I think as we grow the amount of available vaccines, that will speed up the number of shots we can give. I think it's reasonable to talk about reaching that herd immunity level right now, at least the way we're going, with that late summer kind of target. Will it change? It could. If we get, and I'm all for doing it more efficiently and getting it done faster.
Along those lines, Ross, of getting to herd immunity, which is a great point to discuss, is, as you said, getting people the safety of the vaccine and getting people to take the vaccine. One of the things that I've heard about the Johnson & Johnson vaccine is that even though it's less efficacious at protecting you from getting the virus, it actually is very effective at ameliorating the severity of the disease if you get it.
This is the most important number that I could say, is that of all 5 phase 3 trials, so all 5 companies, there were 0 patients that were hospitalized with COVID-19 after they got the vaccine. So we could talk about the different efficiency numbers, that 0 patients of thousands of people that got 5 different vaccines for coronavirus did not require to go to the hospital is amazing news, because that's what you want, right? Your main goal is to get people not to get really sick, not unfortunately needing hospitalization and potentially dying. Mild stuff, again, we'd like to get better and we're continuing to work on that. But I will take a mild form of disease over severe, where I need a hospitalization, a breathing tube, and where I could potentially die. And the fact that 0 people out of all the phase 3 trials required hospitalization is great news. And so I wouldn't miscount that. And so that's an important part to understand regarding these vaccines, of how much they can help, because you don't want to be in the hospital. Look, I work at a hospital and, I have to go back every day. They make me, but you don't want to be there as a patient. And so if we can prevent you from going to the hospital, I think that's great when it comes to the efficacy of the vaccine.
As a wrap up, we are still in Arizona, though, in substantial spread of COVID-19. We have been at times one of the worst in the world with the spread of per capita spread of COVID in our state, and worst in hospitalizations in our state. We've had a bad run here in Arizona up till now. But I want to hear you as a physician, as a person who's working in the community, help us share what you believe we should be doing to keep ourselves safe and our families safe at this point, especially as we're seeing new variants happening. We want to hear from you. What should people do to try and keep themselves as safe as possible?
Well, yeah, this is basically a race, right? We want to be ahead of the virus. So if you think about the goal of a virus, it's very straightforward for the virus perspective. It wants to spread. We are right now its host as humans. It wants to spread as efficiently as possible and as effectively as possible. So the more chance it gets to replicate and spread, the happier it is. The problem is the more it replicates, the more the chances occur of it mutating to be more efficient. That's where you see these variants popping up. The UK one, the Brazilian one, the South African one. So it's a 2-pronged approach. Vaccines are great, but it's going to take a while, like we talked about. I will tell you, and if you saw on TV, I got my shots on TV for everyone to see. I am fully vaccinated, but I still go out every day and wear a mask. I still do physical distancing. You can't forget to do the spread, to stop the spread of the virus from the front end while we're vaccinating on the back end. It's great we're getting the vaccines. It's great people are getting shots in arms, but you have to do both at the same time. Again, I'm going to steal from Dr. Fauci. If the virus can't spread, it can't replicate and it can't mutate. And that's what we want. We don't want to give the virus the opportunity to mutate enough to get ahead of the vaccine. If you give it a chance to replicate without any checks and balances, it will eventually do that in a faster rate than we're expecting. And we don't want to prevent that from happening. I am not aware of it happening yet, but we really don't want to try to find that out. So again, wearing a mask, physical distancing, hand washing, all of that is still vitally important to make sure you stop the spread of the virus. And then getting the vaccine gives you the protection you need to make sure you don't get it.
Well, thank you very much. We can't emphasize enough that people still need to be wearing their masks. So we want to thank you so much, Dr. Goldberg, for joining us today. Thank you to the members of the House Health Committee. And thanks to everyone who joined us for this House Democratic Caucus debrief. We are hopeful that this brought you some information that is going to help, and we hope you stay safe. So thank you very much.